Uh, since I have a very less time, 20 minutes, and whatever the discussion started occurring in this group about the psychology and about how a patient to be understood, I think if you understand the structure of this entire workshop, first we dealt with a general concept as a headache, as a clinical condition. Then what are the rubrics or what are the specific remedies we are giving to the cases, or whatever the, if you go by the diagnosis. Another, the following two cases are saying about how the headache can be seen from the individual perspective. Because we are trained to give the remedy by the diagnosis. Congestive headache है, बेला देना. Eye related complaint है, spigy लिया देना. Whether that is the method we should follow, or whether we should go by understanding who is that person who is having this headache. Because in the psychiatry nowadays, the concept was very prevalent, but it was not practiced quite frequently. We are not saying that patient has a schizophrenia or he is a schizophrenic patient was the earlier term, or earlier you can say a common language which we are using. Nowadays actually we should use that this is XYZ patient who is suffering from schizophrenia. So in this way even the stigmatization can be avoided, labeling can be avoided, and the same concept we can apply even when we are treating the headaches. Even the clinical spectrum, if you understand, the headache is no longer a that simple diagnosis. Some clinical aspect and some general aspect which I will be presenting over here may be quite new to everyone, because when I started studying this particular topic for the presentation, this was very strikingly felt by me, which probably everyone you must have felt like this. And this will be your experience. You will realize that हाँ ये अपने साथ भी हुआ था, but we have never paid that much attention to the headache complaint. So the title of my presentation is headache. Is it a mental or physical? Because every time we go by a physical symptom, this is true, or we have to modify our concept of headache and we can take to the mental concept as well into the consideration. So again I will be starting with a case of this particular boy. He is a 20-year-old boy, came with the complaints of headache. It is a particular, the frontal region pain which is occurring almost daily. The sensation, he has heaviness, and the pace was gradual. There were only two modalities available in the morning and the evening. And all the examination in this particular patient was normal. Even you can see the BP also. Though it is sensing little, he may go to the hypotensive type of this thing, but still this patient was completely, every day he was getting this complaint. So when we are talking of headache, diagnosis is most important, because since morning we have keep on learning that diagnosis is important. What is and why the diagnosis is important even for the homeopaths? Why the changes? Nowadays we are started having a go by a remedy, go by the specific remedy to the diagnosis which will indicate certain kind of a remedy. So these are the questions that every homeopaths keep on getting. What is the diagnosis? Whether this diagnosis is indicating some kind of a pathology, some kind of a psychological issue, psychological modalities this patient has or not. So when I started understanding this headache, this is a very common reason which picks up a medical attention of anyone. Even the common person will come and say कि नहीं मुझे headache हुआ है, and he will seek the attention. As the sir has rightly described about the primary headache and the secondary headache, but if you see the primary headache so prevalent in the society that every one person in 4 will have this particular headache, and every 1 in 8 person will have a migraine. So you understand the prevalence of the headache as a clinical entity. Nowadays the headache is termed as a headache disorders, and that is the reason who is taking cognizance of all the diagnoses, including the migraine, including the cluster headache. So even the expansion of headache as a term and headache as a disorder has started occurring. There was one study conducted in Karnataka, and which probably has studied how much prevalent the headache is in our community. So it is saying that almost 63% of people in India will have a headache in their 1 year of prevalence, and thus they have calculated the prevalence based on the intensity and the frequency and the duration of that headache was there. And they have found that the people who have a headache more than 15 days, the ratio is more in females. The females have a more frequency of headache than the males. And these are the common expression of many underlying conditions. It will not be only migraine, it will not be cluster, but there could be even the more severe pathology which will give rise to the headache. And out of this 63 prevalence percentage, the 50% of the patient will require active intervention. What sir has rightly pointed in the morning, the people, there was one case he was sharing, that female was consuming the painkiller for 6 or 7 years. So this indicates how we neglect and we underestimate the pain of a headache. And along with that, there is a significant disability attached to this headache as a symptom. I'll come to that. So when we have talked about the headache, the burden, how it has created on the common people, and how the disability has produced because of this simple headache. So you can say that because of the person, the headache, the person suffer, including very substantial personal impact, the quality of life also get impaired, and the financial cost. If the person is suffering of migraine and he is unable to attend the job, then what will happen to his future and his financial growth? Even there is a constant fear, the person who has a migraine, that person will have a constant fear whether the headache will be precipitated or whether the headache will be there even on the next day, whether I will have the same intensity or intensity will be less. Even the many times the apprehension of having the second headache also can give rise to the increased quantity of a next episode of headache. And even the people who is suffering a long duration of a long-term this thing, they are likely to undergo the depression and anxiety, because the constant headache will definitely going to give some or make some psychological changes in that individual. And it is mainly found the people who have a migraine, they may have the depression and the anxiety as a comorbid clinical phenomena. Again, this is a scientifically proven, so you can search these references, whatever I have mentioned over here, and you can learn more about this. So again, the study says that though the headache is diagnosed, though the article is saying that there is a need of an intervention to the 50% of the population, but if you study again the prevalence, only 30% consult doctor. Many of the time over-the-counter drugs have been taken, they hardly go to the physician, they hardly consult anyone for the diagnosis. And most of the time it is seen that out of that 30%, 80% will go to the primary center. They will not go to a secondary, or they will not take any opinion of a super specialty. And from that only 50% will consult a specialty doctor. So you understand how this headache is either ignored or underestimated by many of the common people we are addressing or we are catering to. And this indicates that there is a lot of gap between the diagnosis, the process of getting diagnosed, and the treatment. And this is very, very huge. What sir also has said in the beginning, many of the people, they die before diagnosing, because considering the simple acidity, many of the times the people ignore that. It is like that. So I'll just go through the common causes, and if you see, the tension headache is a very common, and almost 69% you are able to see, and the vascular and the brain tumor will have a 1%. But if you address to the common people, whenever the patient comes to us, he always talks about कि मुझे brain tumor तो नहीं हुआ है ना, मुझे कोई head pathology नहीं हुआ है ना, and the anxiety will start building up. So instead of going to a proper diagnosis or a proper listing, he will himself start building upon his own ideas and his own diagnosis about his complaint. So as sir has taken about when a headache can be considered as a severe as a warning sign, I will not go into much about it. But definitely I will indicate, or I would like you to pay attention, whenever the patient of headache comes, we also need to pay attention to the psychological state. What else? We have a postgraduate institute, we have a PG residents who takes the cases and they brings to the consultant for the opinion, but he asked the promise that this information will not be shared even by the resident to their colleagues. So the amount of secrecy, see the amount of secrecy this individual has. So we can consider this symptom as a secretive person, the core which Ajit sir is trying to highlight, the nucleus of this patient which he wants to highlight. So then this person did not speak much about it because we did not promise that ki baba residents said they are going to share, they are going to inquire with this. Then the second resort was tried by talking to his parents, and when he himself started talking about the parents, he said he believes that his parents are purposely disturbing him and not allowing him to focus the studies. He said he was a very bright student but could not study much in 11th and 12th, and he is appearing for the NEET, and there also he could not score much. So he has attempted almost twice or thrice, and this was the third year, the third attempt he was going for the NEET exams. And his father probably has threatened him that unless you clear this third attempt, otherwise I will put you to the BMS and BHMS course where you have to go. And this particular person, he said he do not want to go for BHMS and BAMS, he only wants to pursue
5 minutes more.
Yeah. So he just only wants to pursue MBBS in this. And since he was very afraid he will be able to put, the parents will put him to the BHMS, when the third attempt he was appearing, he attempted all the questions but he did not push the button of submit all. So it was a zero, so there was no chance of him getting admission anywhere. And he said, again he started complaining about the parents. His parents want him to go to the Nanded. Nanded is now has become a hub. If you want to crack a NEET, so you go there and you can crack the NEET. So, and he's saying the parents are not doing any favor for him. And he said he has a fixed delusion, he is born only to become a MBBS, he does not want to go for Ayurveda or homeopathy. But when you ask the parents about their observation about him, the parents said he does not want to do the MBBS, he wants to do only MBBS and not the other thing, but he is very angry on the parents. And why? Because he is saying his parents force him, all the time forces him for the study, and he gets very wild, and because of that the anger is there. There was one incident where he has complained to the police for the parents are harassing him for the studies, and the police literally came to their home in the midnight, and they have started investigating what mean the parents harassing to the child. See, in the Indian context it is very rare, but if you go towards the abroad, probably the child harassment is very the people take it seriously. And when the parents told about this, the parents have already spent a lot of money on this individual. They had sent him to the Nanded also, and this fellow came back in one night without giving any explanation. So what are the qualities you are understanding of this individual? This is very secretive. This person is having a own ideas or a fixity in the thought. He is born to do something peculiar job only. He has a delusion, he has an anger. Whenever he gets angry, whenever he is contradicted. So these are the qualities you are able to identify in this case. And the mother has shared some observation about it. Along with that, he has a behavioral changes. He has become more irritable, obstinate, defiant, lying, and he wanted to be in his room by locking inside that room. And whenever he is saying the parents are interfering too much, now you pay attention to the preliminary. He has studied till 11th and 12th, now he is at 20 years. And this person who is accusing his parents like this, and if you see what reality checks we are having of this individual, they do not go as per the normal developmental psychology of any adolescent. Any adolescent who is normal probably will be always motivated towards his aim. He will like to fulfill his aim. He will follow for. Though the certain adolescent will have a rebellious nature, but that sort of a background, the adverse background has to be there. In this individual, the background was not adverse. Since both the parents were government teacher, they were forcing or they were having this expectation that at least my child should get graduated. If not the MBBS, then at least BAMS. But this individual has certain own ideas for himself and he is imagining quite great about him. And everything has started occurring since 6 months. So when certain questions was asked, then he said he has a difficulty in concentration, and probably that has led to the second interview of this case. And what we come to know in the second interview, this person has a difficulty in concentration. He cannot concentrate because of the constant thoughts. The thoughts which is almost preventing his memories, preventing things to memorize the topic. Many thoughts which are unreal, unrelated. Sometimes we think he is intelligent and there is no need of study. He can crack the NET like this only. So again you can see how overvalued idea he has of himself. And he is continuously having the self-talk. Many times we think the self-talk is good because it is giving you some insight about yourself. But this person is unable to concentrate because of the self-talk, because of the thoughts, and those thoughts are making him irritable.
Time up.
And he cannot control.
Wind up, huh?
Yeah. 2 minutes. So I will not explain about this stress cycle, how one individual goes through the stress cycle and how the negative changes are responsible for producing even the behavioral changes in the individual. So approach to the diagnosis. I will again not go into the details of this. This was the approach used while understanding the diagnosis, and I differentiated the clinical diagnosis in this case. So what is there with me right now? It's a headache. The specificity is not available. Along with that, I have a mental concomitant in the terms of overcrowding of thoughts, the thought making his concentration difficult, and the thoughts which cannot control. Any cases for the diagnosis? It was a tension headache with the obsessive rumination disorder. I'll just explain in short what is the obsessive rumination disorder. It is a type of obsessive compulsive disorder where an individual is constantly engaging into repetitive negative thought process that loops continuously in the mind without any end or a completion of one thought. And this pattern can be distressing, difficult to stop, and unusually involves into the repetitive negative thoughts when you try to solve the problem. So this was the totality, the simple totality, what is available in the case. We have prepared the totality: anger, consolation, fear, secretive, suspicious, theorizing, and the violent. And this was the repertorization, prepared the totality taken into this. I hope you are able to see the remedy. The first remedy is aurum, sepia, lyco, veratrum, ignitia, and Sunita. So this is a simple differentiation method I have followed. Whatever the core or a patient as a person was available to us, what we have found, this person is a very ambitious. At the same time, he has a boosting idea about himself. He can do anything and everything in the life, but when you see in the reality, he cannot do anything. So that has helped us in understanding the core of the remedy. Any cases? Veratrum. So the veratrum was prescribed. Even the potency was decided on the basis of our concept of susceptibility, sensitivity, the characteristic symptom, and the 200 potency was selected. So what I learned from this case? I learned that there has to have a detailed onset, duration, progression of every complaint. Even I think the Pradeep sir also has highlighted in that. Along with that, I would like to add 2-3 more questions. What if every physician is asked to asking himself what we are treating, when we are treating, at the what stage of disease we are treating, why we are treating, what is important in this, and how we should treat this simple headache complaint. At the same time, if you are able to get the answers to this, then probably the approach to the headache will be pretty clear and very easy also. At the same time, you have to understand the mental state. It is not a mental state from the psychiatric point of view, it is a mental state even we commonly keep on doing on this. At the same time, you should have a common knowledge of disease and the differential diagnosis. Adolescents or some psychology, which I was talking in the in between, and the knowledge of materia medica.
Thank you, Sunita ji. So we
Yeah.
are continuing. Thank you very much.